With proper treatment and healthy lifestyle changes, you can stop stage 3 kidney disease from evolving to stage 4 or stage 5 kidney disease. In stage 3 of chronic kidney disease, your kidneys may have mild to moderate damage, so they are less capable of filtering waste and fluid out of your blood. This waste can build up in your body and begin to cause damage in several different ways, such as increasing blood pressure, causing anemia, or weakening your bones. This buildup of waste is called uremia, which literally means urine in the blood. By the way, both urea and creatinine fall in the category of toxins that build up when you have uremia. This waste buildup can be minimized with the help of some healthy diet and lifestyle changes to keep your kidneys working well for as long as possible. Eating kidney-friendly foods or certain nutritional supplements in the right amounts is one of the best ways to protect your kidneys from CKD. To do that, you will have to make strategies and diet plans with the help of your kidney dietitian to slow down your kidney disease. So, let's talk about 3 special remedies you can take to lower creatinine levels and avoid dialysis. Number 1. Acacia fiber. The use of acacia fiber or gum arabic is one of the newest dietary therapies to help lower urea and creatinine levels. It is also called intestinal or dietary dialysis as it mimics the process of dialysis in the gut. In fact, during a study that started in 2001, 6 patients with ESRD, end-stage renal disease, were selected and were given a certain dose of acacia gum supplements regularly. Study experts observed that 3 of those patients who did not take acacia fiber and stayed on dialysis died within less than 6 months. Out of the other 3 patients who were treated with both traditional treatment and acacia gum, 1 patient complied with the acacia gum treatment for only 10 days and died after 6 months despite being on peritoneal dialysis. 2 other patients continued the therapy for about a year and maintained both urea and creatinine levels not previously achieved with dialysis, and they reportedly achieved all that without the need for dialysis. 1 of them stopped acacia gum treatment and diet within the first month despite being on dialysis. The other patient, who was an 11-year-old girl, continued the therapy and experienced improved quality of life and dialysis freedom. In short, the study showed that 6-year dialysis freedom can be achieved for up to 6 years. How did that happen? Studies show that these could be due to 2 main reasons. First, gum arabic has been shown to lower oxidative stress and inflammation markers that are closely related to kidney disease progression. Second, the kind of fiber present in acacia gum has been shown to remove urea and creatinine via the gut, improving uremia symptoms and even preventing the need for dialysis in some cases. But remember that being high in fiber, acacia gum can have side effects like bloating, gas, and nausea. Up to 30 grams per day of gum arabic have been used for 6 weeks, but how much you can safely take depends entirely on your individual health condition. So do not start taking gum arabic on your own and consult with your healthcare expert for the most appropriate dosage according to your individual kidney function and overall health condition. Number 2. Magnesium. Magnesium is involved in almost 300 essential metabolic reactions, including energy production, blood pressure regulation, nerve signal transmission, and muscle contraction. Studies have shown that low levels of magnesium are very common in dialysis patients and might also contribute to the progression of kidney disease. Some studies have also demonstrated the effect of magnesium supplements on creatinine levels. In one such study, when participants with hypokalemia or low levels of potassium were given magnesium supplements, they showed a clear decrease in creatinine levels. Study experts suggested that this might be due to the diuretic properties of magnesium. Not only that, magnesium also plays a significant role in vitamin D metabolism. Magnesium acts as a cofactor for the enzymes that activate vitamin D. Our body needs a good amount of vitamin D to improve the absorption of other important minerals like calcium and phosphorus and to regulate parathyroid hormone, PTH. Some studies suggest that magnesium deficiency can increase the chances of impaired vitamin D metabolism. Low vitamin D levels can speed up the progression of chronic kidney disease. The recommended daily intake of magnesium for most adults ranges from 320 milligrams for females and 420 milligrams for males. The amounts may vary in different supplement formulations, so check the label to ensure you take the most appropriate dose. Magnesium supplements come in various forms, like magnesium citrate, magnesium oxide, magnesium hydroxide, and others. So, it is very important to first consult a healthcare expert about the dosage and the form of magnesium supplement you should be taking. Number 3. Astragalus. Astragalus root has been traditionally used to help treat diabetes, kidney disease, and heart disease, and to boost the immune system. Some studies also suggest that astragalus supplements might help treat proteinuria, lower creatinine levels, and even reduce uremic toxins in stage 5 kidney patients. During a study, researchers treated some stage 2 and stage 3 CKD patients with astragalus supplements for 48 weeks. The results showed the slower decline in eGFR, which could mean that astragalus helped in slowing down the progression of kidney disease. The same study also found that astragalus injection reduced fasting glucose, insulin resistance, proteinuria, and creatinine levels in the short term. They also suggested that astragalus might protect kidneys by its immune-boosting properties. Moving on, astragalus might also improve blood flow in the kidneys, as it is believed to widen the blood vessels and facilitate the flow of blood pumped from your heart. This can indirectly improve kidney function, as it decreases the risk of further kidney damage due to clogged arteries and high blood pressure. You can find astragalus supplements in different forms like extracts, capsules, and tablets, and also injectable forms. Experts say that people with kidney disease can safely use 7.5 to 15 grams of astragalus daily for 3 to 6 months. But talk to your healthcare provider to find out what type of product and dose is appropriate for your individual condition. Astragalus is usually safe to consume, but high doses may suppress the immune system. So, avoid using astragalus if you're taking immune-suppressing drugs. These are the 3 remedies that can help you delay dialysis and improve overall kidney function. Now let's talk about other minerals and vitamins that are essential to be managed in people at any stage of kidney disease. Iron. Iron deficiency anemia is one of the common complications of chronic kidney disease. Your body needs iron to make the protein hemoglobin, which helps your red blood cells to carry oxygen from the lungs to the rest of your body. With iron deficiency, anemia keeps getting worse and can cause more harm to your kidneys. You might already know that chronic kidney disease has 5 stages. Studies show that almost 50% of people with chronic kidney disease from stage 2 to 5 mostly experience iron deficiency. You can become low in iron due to 2 reasons: due to a restricted diet and blood loss due to dialysis. Chronic kidney disease makes it difficult for your body to absorb iron from foods like spinach and meat. Plus, dialysis for chronic kidney disease can cause blood loss, which gradually results in iron deficiency. One way to find out if your body has enough iron is to get yourself tested for hemoglobin. The normal levels of hemoglobin in healthy people are about 12 to 15 grams per deciliter for women and 13 to 17 grams per deciliter for men. However, people with kidney disease or kidney failure may have lower levels. Iron deficiency is treated in different ways, and it mostly depends on the stage of your kidney disease. You can take extra iron by mouth in tablet or liquid form, or get iron directly injected into your vein. People on dialysis might get an injection of iron into the blood tubes, or sometimes added to the dialysate, which is a cleaning solution used for hemodialysis. One of the commonly used iron supplements is ferric citrate, which is often used to treat iron deficiency anemia in patients with CKD who are not on dialysis. Moreover, it can also be given to people on dialysis to help regulate their potassium levels. Calcium. Calcium is found in large amounts in the body as it helps in a variety of functions like tooth structure maintenance, muscle movement, and nerve signaling. When you don't get enough calcium or your phosphorus levels are high, your body will try to leach the calcium out of your bones into the blood to maintain the serum calcium levels. When serum calcium gets too low, enough calcium can't go to nerves, muscles, and wounds. This can result in serious problems with the heart and muscles throughout your body. In chronic kidney disease, your blood calcium levels might get too low, causing damage to your kidneys. As mentioned earlier, in chronic kidney disease, the kidneys are often too weak to make active vitamin D. With lower levels of vitamin D, your body absorbs less calcium from the food you eat, so its amount reduces in your blood. Not only that, but extra phosphorus in the blood of CKD patients may also bind to calcium in the blood, further lowering calcium levels in the blood. Several studies conducted on a large number of CKD patients showed a clear link between low serum calcium and a faster time to reach kidney failure than patients with normal levels. Normal serum calcium level ranges from 8.5 to 10.2 milligrams per deciliter. Too low or too high calcium levels can both be dangerous, and both these conditions need treatment. However, patients with low serum calcium have been found to reach kidney failure faster than people with higher serum calcium levels. To manage the serum calcium levels, your doctor might give you magnesium and vitamin D supplements, along with calcium supplements to manage the calcium absorption. So, try not to take any supplement without a prescription from your healthcare provider. Vitamin U. Unlike its name, vitamin U is not a true vitamin, but rather a derivative of the amino acid methionine. It is also known as S-methylmethionine. Vitamin U was first researched in the 1950s when some researchers found that drinking 1 quart or 945 milliliters of cabbage juice can help heal gut ulcers 4 to 5 times faster than the usual anti-ulcer medications available at that time. Some studies also suggested that its anti-inflammatory and antioxidant properties might help protect the liver, kidneys, and lungs from damage. There is also some evidence that vitamin U can help lower cholesterol and triglyceride levels. During an 8-week study, a group of people were given 1.5 grams of vitamin U per day. The results showed an almost 10% reduction in total cholesterol. While the research is limited, there is no recommended dose of vitamin U. However, you can take vitamin U directly from whole foods. Some of the vitamin U-rich foods are cabbage, broccoli, Brussels sprouts, and kale, which can boost your vitamin U intake. But remember, if you have kidney disease, you might have to limit these foods. So ask your doctor about taking vitamin U from the more appropriate sources, such as supplements. Vitamin E. Your body mainly needs vitamin E to neutralize harmful free radicals and support your immune system. It is a fat-soluble vitamin and is found in foods like vegetable oils, cereals, meat, poultry, eggs, and fruits. It is said that people with chronic kidney disease need to avoid vitamin E, but this is not completely true. Researchers have demonstrated many benefits of vitamin E for people with CKD and those undergoing dialysis. One of these studies showed that vitamin E might reduce the risk of acute kidney injury in CKD patients and might also improve kidney function in diabetic patients. Moreover, vitamin E might also help lower high blood pressure and lower LDL or bad cholesterol and triglycerides. Research suggests that vitamin E supplements can help reduce heart disease risk factors as well as kidney disease risk factors. A group of researchers reviewed 18 studies and found that vitamin E supplements can significantly decrease systolic blood pressure, the top number in a blood pressure reading. Typically, 15 milligrams of vitamin E is considered safe and recommended for most adults, including people with kidney disease. However, you may need more or less than that depending on your health condition. Moreover, there might be some side effects when vitamin E is taken in higher doses. These include nausea, fatigue, headache, and even bleeding in very high doses. So, ask a doctor for the right dosage that will keep you safe from unwanted discomfort. Vitamin C. Like many other nutrients in CKD, vitamin C has been thought to cause harm at increased levels. This is primarily because vitamin C can sometimes contribute to kidney stone formation and can cause kidney damage. While it is important to be cautious about its possible harms, oxalate formation specifically due to vitamin C is quite rare, with an estimated prevalence of only 3.6%. During a study, low vitamin C levels were detected in about 64% of participants undergoing hemodialysis and peritoneal dialysis. Low vitamin C levels might also be linked to increased mortality, increased oxidative stress, and heart disease. Based on this, getting enough vitamin C might improve kidney function in people with CKD. The Kidney Disease Outcomes Quality Initiative has suggested the RDA of vitamin C as 90 milligrams per day for men and 75 milligrams per day for women. This also includes people with CKD stages 1 to 5 and on dialysis or following kidney transplantation. However, the actual dose might vary from case to case. Therefore, it is important to reach out to your healthcare provider for the most appropriate recommendations for vitamin C dosage. If you want to know more about how you can improve your overall kidney health, make sure to watch these videos too.